We go down to Brooke Schweitzer down there with James Spearman.
Yeah, Dean and Darren, guys, there's so many great things about high school football. Rivalries, championships, concession stands, lots of good stuff, right? Well, there's also injuries that come with high school football. Joining me now is Dr. Spearman with the Lowcountry Orthopedics and Sports Medicine. Okay, so what are some of the most common injuries that you see?
Well, in football, we see a lot of injuries to the shoulder, to the knees, and to the ankles. Different sports present with different injuries. So we have elbow and shoulder injuries in baseball, and leg injuries in baseball usually involving hamstring tears because players accelerate from sitting position. They sit and get up and run, and so they hurt their legs. In soccer, we see the usual injuries such as ACL tears and ankle sprains, so it depends on the sport.
Yeah, and so what are, really quick, some of the technologies that you utilize to treat some of these injuries?
Well, there's a lot of technologies. There's been a lot of developments over the last 30 years. We have a lot of new diagnostic techniques with MRI and other techniques. Arthroscopy's been around for years, and we use that a lot to decrease the amount of surgery, if you will, that's necessary. I think we talked earlier about concussions. One of the big things we have now is concussion protocols, which helps a lot with concussion injuries, which is in orthopedics, but it's a big part of the sports. And I think also a big thing that's going on now is prevention of injuries. So they have specific programs for like ACL tears preventions. So that's one of the things going on.
Yeah, lots of great stuff happening to treat athletes' injuries, especially high school football players. Dean, Darren, I'll send it back to you.